Winter, we're also getting into the swing of flu season. In this week's Your Community Health segment, WENY's Renata Steele spoke with a pediatrician from Arnott Health about ways to protect your children from the flu this year and what type of vaccines are available.
Hello and welcome to Your Community Health. I'm Renata Steele and I'm talking with Dr. Jeffrey Gardner here at Arnott Health Pediatrics. And this week we are talking about the flu. Flu season is just around the corner, so we've got some important information to protect you and your children. First of all, Dr. Gardner, we hear so much about the flu, so many different strains, but at the very basic level, what is the flu or influenza?
Influenza is an extraordinarily contagious group of viruses that sweep across the country every year, usually from the fall through the spring, with a peak incidence during the winter months, December through March. And they cause a variety of symptoms, I should say. In most people, the symptoms are relatively mild. Fever, chills, headache, coughing, sneezing, runny or stuffy nose, vomiting and diarrhea. In some populations, notably the very old, the very young, children and adults with significant medical problems, sometimes even in very healthy people, it can be very serious and can lead to hospitalization or even death.
And I think a lot of people think, oh, I'm a healthy adult. If I get the flu, I can shake it off, I'll be okay. But the flu vaccine is still recommended. Of course, nobody wants to get the flu, but of course, you don't want to spread it to anybody else either, and children are especially at risk.
That is correct. That is very, very definitely correct. The flu vaccine is available now in most locations. This year, we're using the injectable flu vaccine only. In previous years, we had the option of Flu Mist, which was a nasal vaccine. It's been found that over the last 3 years, the vaccine has proved ineffective against the circulating flu strains. So for this year, the injectable vaccine is the only one that has been recommended.
And now, because there are so many different strains of flu, can you drive home the importance of why it's important to get the flu vaccine every year?
As you bring out, the flu is a very changeable virus, and we hear every so often about bird flu, swine flu. This just demonstrates that the virus mutates or changes very, very rapidly. Usually there are several strains of the flu which are circulating at every or any given year. The experts at the Centers for Disease Control get together with each other and have meetings and review studies of what strains of the influenza virus are most likely to be circulating during the coming flu season. Every year, these strains change. So your flu vaccine from last year is not going to protect you from the flu this year.
All right. Well, Dr. Gardner, thank you for elaborating on that for us, and thank you for joining us for Your Community Health. You can catch the segment every Saturday on Good Morning Twin Tiers Weekend at 7 a.m.